clinic is a must. This campaign seeks to educate our population about ways to reduce maternal mortality before, during, and after pregnancy. Why is this important? Because globally, approximately 189 million women become pregnant annually. 122 million have a live birth. 3 million suffer stillbirth. 10% suffer maternal complications during pregnancy and delivery, and 40% have morbidities and disabilities post-delivery. Every 1 to 2 minutes, a woman somewhere dies during pregnancy or childbirth. So I've already welcomed our panelists, and once again, welcome to members of the media joining us via Zoom, and to everyone who is watching us as well. And we're going to start the discussion by addressing the Honorable Minister. The Jamaican government has been working closely with the European Union. How does this partnership advance the mandate of the Ministry of Health and Wellness in providing quality health care for all Jamaicans?
All right, well, first of all, let me thank you for having me. And of course, Madam Ambassador, how are you? Dr. Spence, other members of the audience here, and to those in, should I say, social media land or?
Digital
land, right? Thank you very much for having me. I want to just, first of all, commend the European Union for this another very important initiative that aims to strengthen the partnership and, more importantly, the manifestation of which means a stronger people in so many different ways. For the last 45 years, the European Union, of course, has been a critical part of our social and economic development through a range of activities: poverty reduction, agriculture and rural development, and all of this has augured well for a stronger society. The Program for the Reduction of Maternal and Child Mortality, PROMAC, is yet another very important initiative. And that initiative, in keeping with our 2030 vision to reduce global maternal mortality ratios, has created significant capacity in terms of infrastructure. We've seen a number of hard infrastructure being developed. In fact, was it last week or the week before we were in St. Anne at St. Anne's Bay Hospital. I believe this week we're at Victoria Jubilee Hospital, so we're spending a lot of time together, and for the right reasons. And essentially, we are unveiling a number of high dependency units with all the necessary modern infrastructure to support both mother and child care. And this is in keeping, again, with the goal that we have set ourselves, but also a part of the European Union's own commitment to the development of the Jamaican population and the Jamaican people. So from a public health perspective, the European Union has been a very important partner, and we're very grateful for that, and at a significant cost. I believe the total cost has been about 22 million euros, which is not anything to frown on. So in response to your question, significant support in public health in this instance, and in keeping with the launch of this campaign, significant support to mother and child care. And clearly there's a gap that we need to fill, and these resources are going to be assisting in filling that gap.
Thank you very much, Minister. 22 million euros. That's quite a bit, Ambassador Vasilevska. So could you expand for us on how the European Union is helping to advance the well-being of pregnant women and their babies through this partnership?
Thank you so much, Delia. Minister, members of the panels, thank you very much for organizing this. Since I'm not an English native speaker, it might be advantageous for the viewers to be able to understand me if I speak without a mask, if the Minister allows that, of course. So this is indeed the first time European Union is supporting health sector in Jamaica. Back in 2013, my predecessor and then the Minister of Health decided together with the government and administration, that health sector indeed needed support of the European Union. Therefore, it became one of the 3 sectors selected for this current financial cycle. And the focus is on reduction of death of mothers and babies during birth. And I'm very proud, and I keep stressing that it needs to be recognized that this administration carried this program so well. And here today we are, in fact, in the last few months, reaping the results of many years of hard work of many of our colleagues and our predecessors. So what we're focusing on is providing training, equipment, infrastructure, and also working together with civil society to help communicate those messages to women, in particular women who are in slightly less advantaged economic situations and in rural areas. Because I've heard too often in my 4 years here from Minister himself that too many women meet a doctor for the first time when they're giving birth, which means that they do not go to the clinic, they do not look after their own bodies, they're not aware of the risks that their unborn babies are exposed to during pregnancy. And that just cannot happen. This should be a right to health should be a basic human right. And pregnancy and childbirth should be the happiest and most beautiful moments in a life of a woman and a life of a family. So looking after the health of an unborn baby, looking after the health of the mother is something that we're very happy to help the government to provide to the women in Jamaica.
Thank you very much, Ambassador. Dr. Spence, PROMAC Coordinator and Director of Health Promotions in the Ministry of Health and Wellness. That's an interesting thing that we've heard from the EU ambassador in terms of women, doctors not seeing them until they're about to give birth. Mm-hmm. So tell us exactly what kind of data informs the needs that we're trying to address through this program.
Right. So PROMAC, the Program for the Reduction of Maternal and Child Mortality, really was established through the vision of the government of Jamaica with grant funding from the European Union to support Jamaica in achieving back then the Millennium Development Goals 4 and 5, which you mentioned earlier, and now which has been subsumed under the Sustainable Development Goal, Goal 3 in particular, that seeks to ensure health and well-being for all at every stage of life. And as such, this program was very timely in supporting some of the health system gaps that we had, especially when it came on to maternal and child care. And so in terms of reducing infant and neonatal mortality, as well as reducing maternal mortality, it was seen that this program would be able to strengthen the health system and help us to achieve these specific targets. In terms of the specific objectives, 1, it was to reduce the incidence of neonatal deaths due to inadequate access to high dependency care, hence the establishment of maternal and neonatal high dependency units at facilities across the island. We wanted to improve the quality of management of high-risk pregnancies at both the secondary and primary health care level. 3, to improve the population health-seeking behavior regarding maternal and child health, because part of it has to be the personal responsibility of women in the reproductive age group and their core support groups to ensure that they seek care in a timely fashion. And so Jamaicans, women often tend to think that I've been there before, and so therefore they don't necessarily seek antenatal care in a timely manner. And so we wanted to ensure that a part of this program was a health education campaign to ensure that women seek care and seek it early. And lastly, we also want to ensure that we also strengthen the institutional capacity within the Central Ministry of Health and Wellness, as well as our regional health authorities, to ensure that when we have grant funding of this type and of this nature, we're able to build programs and projects of this nature to help to continue to strengthen our health system.
Thank you very much. A very critical response, but also a very effective one that we're hearing today. And so, ladies and gentlemen, here's a look at the highlights from the PROMAC NFPB Healthy Body is a Must, Clinic is a Must campaign.
Boy, Mitzi, that pregnancy stop me a call for all heap of things. Clothes, pampers, crib.
Oh, you read so far already. Me no hear you talk about clinic checkups, iron, folic acid pill, healthy food and them something there.
What all of that for? My mother have 5 hours and never gonna clinic and she eat what she feed for and we did alright.
Your pregnancy and your mother own are 2 different something. You climb up in a age and say you're high risk for sugar, high blood pressure and other things that can affect you and your baby even before a time for the clothes, pampers and crib. You try your best go to clinic early and go get your checkup. You hear me, Diana? Once a baby business, clinic is a must and a healthy body is a must.
Healthy baby, healthy you. It's easy to learn what to do. This message was produced with the financial support of the European Union in partnership with the government of Jamaica.
Boy.
All right, so we hear Diana getting some useful tips there about ensuring she goes to the clinic, as well as some of the issues that may affect her, high blood pressure and other things that we have discerned from the data. And on screen, you're also seeing some of the visuals. Let's talk, baby talk. Healthy body is a must. Exercise, eat right, and visit your clinic.
Meet Keisha, a 35-year-old secretary. She just got some surprising but good news that she's itching to tell her partner. Meet Chris, a 40-year-old mechanic. He just heard the news. Keisha's pregnant.
Babes, I'm not sure about all this pregnancy thing, you know. Plus, what about the sugar where doctors say you have trouble with?
Oh yeah, that sugar something there. Not even remember about that. What we are going to know?
Now would be a great time to set your first doctor's appointment.
But we're want to talk about doctor expense that.
Remember, free healthcare? You can visit any clinic close to you. We have many free health centers that offer antenatal services. Healthy baby, healthy you. It's easy to learn what to do. This message was produced with the financial support of the European Union in partnership with the government of Jamaica.
All right, healthy baby, healthy you. I like it. It also speaks to some issues that women may have before pregnancy and that may affect them adversely when they become pregnant. So antenatal care is critical. So we're going to be joined via Zoom by Dr. Carol Lord in a minute. She is Program Development Officer at the Family Health Unit at the Ministry of Health and Wellness. And we're going to be talking a little bit about the relevance of the campaign, but first, let's see if we can share some more of the campaign bits with you.
Is very important. I believe that this campaign is very relevant because in order for us to think about pregnancy and all the complications that can occur during pregnancy, we have to ensure that our bodies are optimal before pregnancy occur. And so we encourage persons to have prenatal counseling so that you can have a healthy body. You will get counseling as it relates to nutrition, diet. If you have any non-communicable disease, you can ensure that they are controlled. If you have high blood pressure, ensure that your blood pressure is controlled. If you have a little extra weight, you're a little fluff, ensure that you lose weight before you become pregnant. So healthy body is a must because you're looking forward to great outcome. Clinic is a must, yes, because internationally it has been shown that best outcomes occur when we have skilled attendant attending to babies and mother. And so at clinic, there are several things that are being done. For example, we have a risk approach to clinic where screening is done. Screening as it relates to whether the person is can be considered a high-risk candidate, of which all the supplies that have been collaborated with us through the EU will assist with the high dependency areas. If they have anemia, it will be controlled before. And we have health facilities across the nation that persons can access care. So we've ensured that care is accessible to all in Jamaica.
Thank you very much, Dr. Lord, explaining there why a campaign such as this is extremely relevant. Ambassador, she mentioned some other areas, particularly areas that make women more vulnerable more susceptible. Can you inform us what other health programs are supported by the EU at the Caribbean level?
Thank you very much. Apart from supporting health sectors bilaterally in other countries, because Jamaica is not the only one in this region that does not have adequate, easily available health system, we also support some regional programs. So particularly now in the times of the pandemic, this has become extremely important, because I think it illustrates to all of us that alone we cannot find solutions, and standing together in solidarity is absolutely crucial if we're going to overcome this, and if we're going to address issues such as affordable, functional public health sector for the people of the Caribbean. So in partnership with Caribbean Public Health Agency, CARFA, European Union has mobilized this year a total amount of €8 million to cater for the countries, for the region's most urgent needs in managing the fight against the pandemic. And this new regional project will also benefit Jamaica. Apart from that, and this has been announced I think 2 or 3 days ago, European Union signed for a 5-year, €7 million agreement with the Pan American Health Organization to enhance coordination and increase the climate resilience of health systems in the Caribbean Forum community to better prepare and respond to climate threats. Here we were also looking at energy efficiency of the health sector, and I hope very much that we can advance that. But let me also say that I don't know whether it's the persistence of this minister, or whether it's a coincidence, or whether it's just lucky, but the health sector here in Jamaica is also benefiting through some of our other programs. So the poverty reduction program, which is finishing after many years of delivering to the poorest community, is also financing some health clinics. So this is just to mention a few, but of course we have put a COVID lens on all our programs to make sure that money can be redirected and to focus on those things that have been highlighted, particularly during the epidemic, such as increase of domestic violence.
Dr. Lord, I wanted to ask, there's a December 2011 study prepared for the Ministry of Health and Wellness, supported by the United Nations Population Fund, that determined that maternal mortality rate is 89 to 100,000 live births, and infant mortality is 21.3 per 1,000 live births. How does this impact the current capacity of the health system in Jamaica?
Okay. Thank you. Actually, as it relates to the maternal mortality and the infant mortality rate within our nation, that has actually been on a stable way, in that we have been able to have the facilities around the nation to be able to have persons have easy access. One, we have had skilled attendants, we have training at these facilities to ensure that optimal skill, the persons are having skilled, so that when we recognize any gaps, they are being closed. And we want to mitigate risk for maternal and infant mortality. And so we want to ensure that we have the skilled birth attendants during care. So we want to see not only during healthy body before the pregnancy, but we want to ensure that optimal care is offered during pregnancy and even after pregnancy, where we're looking forward for better outcome. And so the health system within Jamaica is equipped to help to reduce the infant and maternal mortality within the nation.
Thank you very much, Dr. Lord. Great ways to minimize the risk. Dr. Spence, what have been some of the activities of the program to date?
Wow, so there have been many. We have been in existence since we signed the financing agreement with the EU November 2013, and we closed off November of this year. And under the 5 components of the program, under component 1, which speaks to newborn and emergency obstetric care being improved, we have added 38 new high dependency beds and 10 new isolation suites. And this is both for maternal and neonatal high dependency units across 4 facilities: St. Anne's Bay Hospital, Spanish Town, Victoria Jubilee Hospitals, and Bustamante Hospital for children. And this was to a tune of approximately 9.6 million euros. In addition, we would have procured equipment to furnish these high dependency units and isolation suites, which include patient monitors, ventilators, critical care beds, infant incubators, and phototherapy lamps. Under component 2, which speaks to the quality of primary healthcare and referral system being improved, we spent approximately 1.2 million euros in the provision of ambulances to the primary healthcare teams within 6 parishes. We also purchased radiographic and ultrasound equipment to strengthen the diagnostic services, including lab equipment as well. And we provided fully equipped midwife bags to the tune of 154 or primary healthcare nurses in terms of helping to assess mothers during their pregnancy within the community. Under component 3, we looked at training, and so we wanted to improve the clinical knowledge and skills among our healthcare team members, and we invested approximately 2 million euros in this area. And so we worked with the University of the West Indies to train doctors in different program areas, including neonatology, critical care, maternal fetal medicine, obstetric ultrasound. We also worked with the University of Technology to train nurses in post-basic midwifery and critical care. We would have trained our primary healthcare team across the length and breadth of Jamaica in terms of how to manage high-risk pregnancies. And we trained over 1,200 healthcare workers under this program area. Under component 4, under which this campaign is being launched, we were targeting improving the health-seeking behavior of the target population and looking at the role and effectiveness of civil society being enhanced, and this was to the tune of 1.3 million euros. And so we worked with non-governmental organizations such as Rise Life Management in a campaign that they had earlier during the project, Healthy Baby, Healthy You. We're working with UE, the Community Health and Psychiatry Department, in partnership with ROC, Women Resource Outreach Center. And they are looking at mobilizing civil society around looking at the rights of mothers and babies. And of course, National Family Planning Board now, in terms of this campaign, looking at how it is that we improve the reproductive age group women seeking healthcare early. And then under component 5, which looks at institutional strengthening and capacity building, we would have had team members from both the regional health authorities as well as the Central Ministry of Health looking at being trained in project management, inventory management, EU financial and contractual procedures, because the hope is that even though this grant funding is coming to an end, certainly in the future, health will also continue to benefit from the EU support and also strategic planning. And so we have done a lot across the entire breadth of this project, and if you note, it is across the entire health system. So it wasn't only infrastructure development, but investment in human resource was also critical to ensure that we continue to reap the benefits of this investment.
Thank you very much, Dr. Spence. You heard it: infrastructural development, training, partnerships, behavior change campaigns, capacity building, ambassador. I'm sure these are among the things that you are specifically looking towards in terms of projects and programs to be implemented in PROMAC.
Well, it's always much better when somebody else lists the achievements of the project than when you have to do it yourself. But I'm sure if our counterparts who sat down together back in 2013 and dreamt what could be achieved under this program heard what was achieved and what we now have the privilege to finalize, they would have been quite happy. Whether it's adequate for the needs in this country is another story. I think plenty more could be provided. We are in the middle of discussions whether one of the health system strengthening programs could be a continuation. That would be a loan from IDB and a grant from European Union, 10 million euro this time, and that would be a project to strengthen Jamaican health system in order to tackle non-communicable diseases in the country, such as diabetes and obesity. But I think we still have plenty to celebrate. We had the privilege to open one of those high dependency units 2 weeks ago. We're doing another one tomorrow. It really is a joy to look at a facility that is up to the highest European and world levels in terms of equipment. For me, it was a joy that the equipment arrived in time for the COVID pandemic. It was a demonstration of the best of European technology, from lamps to beds to ventilators, really at the highest technical level. And it's wonderful that all of this will be available to women in Jamaica. Because they're high dependency units, we also hope they won't need to be used so often. The maternity wards themselves are still a little bit crowded. I would love one day to be able to be part of the project that provides a better space for them. But I think there's plenty to celebrate, and I would like to take this opportunity. I don't know whether I'm going to have the floor again, to particularly thank the Minister, the PROMAC team, and all your staff for fantastic cooperation. It really has been a joy to work on this project, and I hope we open all the high dependency units before it's my time to go.
Thank you very much, Ambassador. I mean, just listening to it, you can tell that from an administrative perspective, PROMAC is an extensive project. And so we're joined via Zoom with Denise McFarlane. She's Public Health Specialist at the Planning Institute of Jamaica, the PIOJ. Hi, Denise. Can you tell us a little bit about the PIOJ's involvement with the program since its inception?
Thank you, Dahlia, and good afternoon to the panelists there, Minister and Dr. Spence and the EU Ambassador. So the Planning Institute of Jamaica is responsible, along with the European Union, for oversight and management of the Jamaica-EU cooperation, which includes PROMAC. So PROMAC was the first major EU-funded program focusing on health. At that time, the progress towards reduction of maternal mortality was very slow, and we needed to accelerate us reaching the goals, the Millennium Development Goals. And so the EU was able to respond to that health need, a particular need we had at the time. So the PIOJ played a very important role in conceptualizing and framing of PROMAC, along with the Ministry of Health and Wellness and the EU. PROMAC, as was described by Dr. Spence, is multifaceted. So it has construction, it has works, equipment, public education, training, and research. And as such, it required a wide range of health professionals, both from government and externally, to really pull together in expert discussions and put together a program that would stand up to scrutiny over time, and we would be able as well to see the impact on the health sector. So during the execution of the project, as we are in right now, the PIOJ led the procurement process for the construction of the high dependency units, and also for securing of the ambulances, and as well as the equipment for the high dependency units. And we also provide some technical services to the Ministry of Health and Wellness. And as a result of our successful implementation of this program, as you can hear, rightfully so, the EU is able to now execute another health project in the form of the strengthening of the health systems with another 10.4 million euros towards non-communicable diseases. Awesome. This is also a reflection of the successful implementation of this program.
Awesome. From your end, listening to the messages coming out of the campaign, what's the impression of the PIOJ from what they're hearing so far?
The PIOJ is very excited. We are just delighted to know that all the components of the program are being implemented. In general, if we are to reduce maternal mortality, then it must start with prevention. And with prevention, the woman must know. So the woman should know that clinic is a must, even if she's healthy. And then if she's sick, then she's also encouraged to go to the clinic to guard against undesirable outcomes. The PIOJ therefore endorses all the messages as its progress towards our national development agenda. This program is directly aligned and articulated in our successive medium-term socioeconomic policy frameworks, which is the main mechanism through which our vision, our National Vision 2030 Jamaica Development Plan is implemented. And so we really want a healthy and stable population. Where there are fewer maternal deaths, it indicates an improvement in the delivery of care and more reliable vital statistics. So if we identify all the determinants, which one of the determinants would be a lack of information and educating of our mothers, then we design programs now to really fill that gap. And this program is one of such. And so we're very proud to endorse the Ministry of Health and Wellness in this venture under the PROMAC program.
Thank you very much, Denise. Always great to know the stakeholders are happy and are working together towards a positive end. But one of the most important stakeholders in this project are the women themselves. And as Denise said, lack of information and education is necessary. So Dr. Lord, I'm going to come back to you. What is the personal responsibility of pregnant women, and are you seeing this in your clinics?
Women have to make their health their priority, and that is very important. They must be able to ensure they have that health environment, ensure that even though they have busy lives, to set aside time to visit clinic. So clinic is a must. Mm-hmm. They have to ensure that they have good sexual health. In that, for example, they know that they are pregnant, they must ensure that they use a condom to decrease transmission of the sexually transmissible infection. So that is one of their responsibility. Ensure they have good sexual health, create a healthy environment, ensure that they attend clinic. The first period that they miss, they must attend clinic. That is very important. And to ensure they maintain optimal health by using their supplements, ensure that they have their immunization and receive the counseling that is given to them at these health facilities.
All right, so you're saying, and my next question was going to be, at what stage in pregnancy should they come to the clinic? Because we keep saying antenatal. You're saying as soon as they feel as if they may be pregnant, they should just head to the clinic.
Yes, thanks. Yes, thanks. That's the best time. Early accessing health early. We'll be able to assess you, screen you, and see where there's any comorbid infection, comorbid condition. We'll be able to address it early. And the early we recognize this comorbid condition, we'll be able to have better outcomes for both mommy and baby.
So I'm hearing personal counseling, I'm hearing screening are some of the things that are offered at the clinics. Is there anything else that's offered in terms of services to pregnant women?
Yes, thanks. In addition to screening, we screen for anemia, hypertension, diabetes, sexually transmitted infections such as syphilis, HIV. We screen for sickle cell disease. We just had sickle cell disease last week, Friday. It's World Awareness Sickle Cell Day on Friday. In addition to that, we have immunization. We ensure that they're optimal to fight against any form of infection. We ensure that they're fully immunized, and that is very important. We have counseling. They're being counseled not only to go through the pregnancy, the journey of pregnancy, even though it's an unusual one, it's a normal physiologic state. And so we try to counsel them as to how to live with the pregnancy and also how to take care of the baby. So counseling is very important, including breastfeeding after the baby is born. So antenatal clinic is a must, is supportive.
When you say health clinics to people, sometimes they say, oh my gosh, the wait is going to be so long. How do you respond to that perception to pregnant women when they come to the clinics? How long will it take for them to be seen and to access services?
Okay, we have, at the clinic, we have an appointment system. And with the appointment system, they're given an appointment to come to the clinic. They have the assessment that needs to be done, including an interview at the clinic. So it is according to the appointment, they'll be seen, but they will know that they can leave the clinic once they stick to their appointment. They can leave before the half day. And so we ask them, listen, when you recognize that you're pregnant, ensure that your employer is aware. And so you say, well, listen, I will have to go to clinic on this day, and on several days, sorry. And so that is important that you inform your employer so that you'll be able to be given that time to attend clinic. So even though the wait may appear long, there are several things that has to be done. Even while they're waiting, they receive health education at that time. So it's not a wasted wait.
You mentioned employers, Dr. Lord. What is your word to them as they watch this broadcast? How should they support women in terms of helping them to get the time to access services? And for women as well who may have younger children and other issues that may be a barrier to them accessing services.
Well, as it relates to the employers, I want to say to employers, you need to see the next generation as a priority. And so when the women are pregnant within your institution, you should be able to allow them the days off to attend clinic. That is one. And their partners, we're not only for maternal health, but we also need their partners must be able to come to the clinic to support them because they need support throughout this pregnancy journey. And so we want to say to the employers, listen, the females are pregnant, but please ensure that the partner be able to get some time off to attend the clinic with the females so they'll be able to learn from this tender age the whole idea of family, which is important.
All right. Thank you so much, Dr. Lord. The National Family Planning Board, they're also a key stakeholder in this program. And Lovett Byfield, Executive Director, is a member of our panel. Lovett, what are some of the trends that you've noticed in the way women access the clinics that would prompt the need for this campaign?
Okay, thank you so much, Delia, and Minister, Ambassador. This is really a very important part of our mandate in terms of getting accurate information out there. And our main mantra is health promotion and to ensure that accurate health-seeking behaviors are promoted. When we look at the women in the clinic settings, we observe several things, several behaviors that we recognize are mitigating against them accessing the best care. And so you have mentioned before, the other participants have mentioned before, that women tend to present late for antenatal care. And we are targeting women who are economically disadvantaged in particular. And we know their lives. In many instances, they are unable to keep or they don't keep their appointments based on their obligations such as work and child care. And there's also the issue of tradition where their mothers or they're being experienced mothers, they don't want to come to care because they think they already know what they need to do. The advice we give on diet and bed rest and general health is usually not taken because of the other beliefs that they have. And the warnings around the pre-existing conditions which would exacerbate the risk, that also is a challenge. And with those who have the special needs, and we recognize and make the referrals for specialized care, a number of factors mitigate against their, in fact, taking up the specialized care. Specifically from the National Family Planning Board, and we recognize also that there's limited contraceptive counseling around timing your pregnancy, and so we find that there's a lot of unplanned and mistimed pregnancy. So we have to see how best we can address that. And we have also noticed that owing to the advancement in fertility technology, a number of older women are getting pregnant. And so this also has implication for the health of the child, more risk to the baby, and also they are likely to be premature or they might have some life-threatening birth defect. So from that perspective, we recognize that these mothers have to be targeted, especially in order for them to recognize the importance of coming to clinic early. One of the things, one of the very specific objective of the campaign is that we want to increase by 30% the number of women of childbearing age who can identify high blood pressure as the #1 killer of pregnant women in Jamaica. And that if persons leave and get that message, then we are more likely to see that their behavior in terms of seeking care very early. And we want to see a 20% increase in the number of women who seek prenatal care within 0 to 8 weeks. So as soon as you know, you should come to the clinics. And we are expecting that the partners, we want to see a 15% increase in the number of partners of pregnant women who increase their support to their pregnant partners. And we also want to increase by 20% the number of females who know that getting pregnant soon after giving birth is not good for your sexual and reproductive health. You need to ensure that your body rests, before you move on to another pregnancy. So those are the very specific objectives of the campaign, based on what we have seen manifested in the clinic settings.
So part of what I'm hearing is that you translate the research and the data into a kind of a risk perception framework that women understand that this is how it affects me, and these are some of the things that I need to do, which leads me to my next question. Tell me a little bit about the National Family Planning Board's operations within the health sector.
Okay, so first of all, since the early 1960s, National Family Planning Board has as its mandate the promotion of family planning and population planning. In 2013, there was a shift with the integration with the National HIV/STI program, and so we are also responsible now for HIV/STI prevention and also the enabling environment and human rights. And so we have a broader mandate being sexual and reproductive health right now. So our mandate is to train healthcare providers, particularly as it relates to sexual and reproductive health. Our work is primarily through the regional health authorities, the CSO partners, and we in fact work with them for the implementation of the sexual and reproductive health programs in the clinics, and we have the responsibility to ensure that our healthcare providers are trained in delivering the family planning services. And so we in fact train our midwives and our nurse practitioners to insert the various contraceptive methods, which include the JADEL and the IUCD. We also have the role to establish protocols and standards as it relates to overall program implementation, and we also do evaluation and training of the providers in addition to being responsible for research. So we ensure that our health promotion programs are informed by the evidence that we get from the research, and we plan our responses, we plan our programs in response to that. And another big responsibility for us is the procurement of family planning commodities. We provide the commodities for the clinics island-wide and also for a few of our CSO partners and 1 and 2 private sector providers. We ensure through our monitoring that the commodities supplies are always available, so we do a lot of monitoring to avoid stock out and to ensure that the conditions under which they are stored, that they are in fact feasible and will not lead to any deleterious effect on the product. So we have a threefold mandate: health promotion and education. We do a lot of training of our healthcare service providers, and we also provide commodities for the population to ensure that they have adequate supplies of condoms, number one. Since that, but we ensure that our message is dual protection, so it's condom plus a contraceptive, which is important.
How do you enhance the experience for pregnant women at the clinics?
Well, since this program, since the PROMAC program, we have been doing specific training of our healthcare providers. And for this, we have in fact a risk card, a risk assessment tool, a very simple tool, because we want the clients to be aware of what is happening and what they need to think about. So this risk assessment tool has some very basic questions which alert them to questions that they should be asking their health provider as they enter the facility, as they enter to have that conversation. The health provider also has the tool, and that is also a conversation prompt for them, so that the critical issues which need to come out of that encounter is in fact raised. And we have, in fact, also been providing some other reminders within the environment, some cues to ensure that persons are alerted to what needs to be part of their interactions within these settings.
Yeah, that sounds like part of your plan to maintain and sustain the progress that you've made. What are some of the other ways that you hope to maintain the gains from the campaign and the project moving forward?
Well, one of the critical things is to continue the on-site training, because we recognize that our providers, for some reason, sometimes you might have some migration, and in addition to that, new person will join the team. We also do in-service training, education as well, within the various training facilities within the Ministry of Health. And we also want to continue our public messaging and the use of our traditional and new media in the same way that we are doing now, so that persons will not see this as a one-time message, but it will become part of their everyday activity, where they recognize that once you get pregnant, clinic is a must, and a healthy body is a must, because that is how we ensure that we reduce the maternal mortality.
All right, thank you very much, Ms. Byfield. Just want to really, share some information. The Ministry of Health and Wellness, through its partnership with the EU, has been on an extensive campaign to effect change across the health system under the 5 components of PROMAC. And some of the successes, you've heard many, but some include component 1, newborn and emergency obstetric care improved, and Jamaica's added a total of 48 high dependency spaces to its hospital infrastructure. This includes 38 new high dependency beds and 10 new isolation suites. Component 2, quality of primary health care and referral system improvement. So there's been a purchase of radiographic and ultrasound equipment to strengthen diagnostic services and ambulances to enhance referral services. Component 3, clinical knowledge and skills of health workers improved. Over 230 doctors and nurses have been trained in specialized programs at the University of the West Indies and the University of Technology in areas such as pediatrics, obstetrics, gynecology, anesthesia, intensive care, post-basic critical care, post-basic midwifery, among other areas. Over 1,000 primary healthcare workers have been trained in programs to improve the quality of management of high-risk pregnancies at both secondary and primary healthcare level. Component 4, health-seeking behavior of targeted population improved and the role and effectiveness of civil society enhanced. So there have been partnerships with NGO Rise Life Management and the National Family Planning Board, and that's resulted in national campaigns to raise awareness. The program has also partnered with the UWI WROC, focusing on human rights in healthcare. And component 5, institutional strengthening and capacity building of the Ministry of Health and Wellness. To date, over 100 members of staff have been trained or are being trained in the following areas: project and inventory management. So lots happening in PROMAC. I want to go back to Dr. Lord, who's the Program Development Officer in the Family Health Unit. Dr. Lord, please tell our viewers, is counseling provided to women who access the healthcare system in general?
Sorry, I didn't hear that.
I was asking, is counseling provided to women who access the healthcare system in general?
Oh, thank you. Yes, thanks. Oh, that is a very major. In fact, when they arrive at the clinic during the waiting period, counseling is being done, education is being done. And when they go to see the healthcare provider, when they go into the examination room to see the healthcare provider, they counsel, as I suggested earlier, they counsel how to take care of themselves during the pregnancy, how to take care of the baby after birth. They counsel as it relates to contraception, even as Ms. Byfield has indicated. They counsel contraceptive use and how to manage the baby, how to identify signs, high-risk signs, not only during the pregnancy, how to identify the high-risk signals or when to the red flags as to seek care urgently. And we have an open door policy at our health facilities for pregnant women, but also how to take care of the baby and how to recognize, okay, what are the red flags for the babies during that time. So they have extensive counseling at the health facilities, yes.
For persons who are watching, where can they get more information about the services that are being offered?
Well, the first place they can go is at their nearest health facility. We have, across the nation, we have 324 health centers, and at each health center, there's a midwife. So that's the first place. You can go to your health facility and you get information. In addition to that, you can call our health line, 888-1-LOVE. You can get information from the Ministry of Health and Wellness. You have the regional authorities. There they have family health coordinators, can also offer information. You have the media right now, like what you're doing, they're going to get some information. And we also have, in terms of for adventure, they need information concerning their emotional health. We have our 888 New Life, our mental health helpline.
I really was going to ask you that question because we've been talking a lot about other services, and I wanted to know how do we address women's emotional and mental health. So I'm going to ask you again to give us the details on that line so people who are watching are able to make note of the line.
Yes. Actually, we have trained persons with the mental health program. And so they're equipped in all primary health care facilities across the nation where they have counseling service available. And the helpline is 888-NEW-LIFE, 888-NEW-LIFE, and that is 639-5433. And there they can call at any time. 24/7 services are available.
Thank you very much, Dr. Lorda. One of the things that came out of the data certainly is that counseling formed a critical part of the program because there were a lot of women who were not generally fully aware of how to monitor chronic diseases during pregnancy, and all counseling sessions were patient-centered. Also, that the quality information and level of testing received for pregnant mothers in the public health system is very extensive and it's quite comprehensive, due in part to the training received by nurses for high risk and normal pregnancies. Dr. Spence, can you tell us some more about the new facility that was recently opened?
Yes, so we recently would have opened with the Honorable Minister and Ambassador the high dependency unit at St. Anne's Bay Hospital. And that particular unit boasts a square footage of approximately over 10,000 square feet. It has both a maternal and a neonatal high dependency unit. The maternal side has 4 maternal high dependency beds along with 1 isolation unit. And the neonatal side has 6 neonatal high dependency beds and 2 isolation units in that space. And it really was a joy to see finally, after how many years of working hard, to have our first official opening of a high dependency unit. And you see Ambassador and Minister there on screen looking at some of the equipment which was procured to outfit this high dependency unit. And just to say that tomorrow we open our next site, which is at the Victoria Jubilee Hospital, another maternal and neonatal high dependency unit. And before the end of next month, we open the other 2 at Bustamante Hospital for Children and Spanish Town Hospital. So yes, Ambassador, we definitely will be doing all before you leave us at the end of July.
All right, before we head to the questions, Minister, I want to give you the last word before we go to questions, because so much is being done, but the responsibility really rests on our citizens to access the services.
Yeah, well, first of all, I've enjoyed the conversation, and let me commend all who have participated. And, I'm really hoping that the public or those listening will take note of the strength of the relationship with the EU and certainly the contribution that have been made in terms of this range of infrastructure and services, which will only be beneficial to the country. In response to the question, yes, it is true that ultimately it's about how we achieve health-seeking behavior, how we take personal responsibility. We have tried in the Ministry of Health and Wellness to promote various concepts in keeping with that. There are initiatives like Jamaica Moves, which promotes knowing your health status, 30 minutes of exercise each day, and of course balancing diet. There's our theme around Everyone Counts now as it relates to dealing with COVID-19, where we say all have to play their part. And certainly in terms of the PROMAC initiative for mother and child, as was said earlier, both the male and the female who are involved in this process of creating and delivering have to play a role. Firstly, attending the clinics, getting the advice, getting the support, supporting a behavior pattern that is in keeping with a healthy child and a healthy mother. And then certainly after birth, giving the appropriate guidance, whether breastfeeding or otherwise. So we really want to appeal to the public to optimize the use of the infrastructure by giving it the support that is necessary. And certainly this campaign hopefully will tie into that and add to a voice that hopefully will lead to that kind of behavior.
Thank you very much, Minister. We're going to invite the members of the media who will be joining us on Zoom to use the raise hand feature to indicate your request to pose a question. And we're going to start with Candice Knight from the Jamaica Observer. Hi, Candice.
Hi, everyone. Hi, can you hear me?
Yes, we can.
Okay, awesome. Well, you introduced me. I'm Candice. I write specifically for the All Woman magazine. I have two quick questions. One, I'm just trying to understand the relationship between this latest campaign and the MNIH project, the Maternal, Neonatal, and Infant Health Project. I know that was slated to be for 3 years and it started around 2017. So I'm just clarifying whether this project, is taking over from that or if it's under it or a completely different initiative. My second question is having to do with how the COVID-19 pandemic has been affecting the antenatal care, or the pattern in which women access antenatal care, especially in rural areas. Women might be fearful that, sick people also go to the health center. So out of caution, I'm wondering if women are tending to stay home. And if that's happening, or if we predict that happening, what's being done at the community health care level to reassure them.
All right, thank you very much, Candice. We'll respond according to the first question. Dr. Spence, you'll take that one?
Yes, I will. So, Candice, in terms of the project, PROMAC, it does involve MNIH, so it's not something separate. They actually are almost like two peas in a pod, a part of the whole. And so one is not under the other, but a part of component 4 of the PROMAC project, which looks at both the aspect of promoting appropriate health-seeking behavior in the target population, as well as ensuring that civil society's role is enhanced in terms of maternal and child rights. So they're working collaboratively, hand in hand, in terms of promoting that aspect of component 4.
Second question relating to how does COVID-19 affect access to antenatal care, especially in rural areas? Would that be you or Dr. Lord?
Dr. Lord, I think, will probably be best able to respond to that.
Dr. Lord?
Yes, thank you. Actually, at first, when we had a total shutdown, we had the persons they had the telephone appointments where they were being tracked by telephone. They're being followed up and monitored. They've been asked specific questions, and so we had the interviews over the telephone. But presently, the pregnant women are ensuring that they attend clinic, and they have been coming to clinic and have the screening done and their pregnancy monitored. They are attending clinic.
Thank you very much, Doc. We have to wrap, so I'm going to invite members of the media, the viewing public, anyone who has questions to submit them. Yes, submit the questions via social media, and the PROMAC team will respond as soon as they are able. So if you have questions, please feel free to pass them on. I want to encourage all women, take responsibility for your health, your safety, and the well-being of your baby. Clinic is a must. And we invite you to share your stories showing us how you stay healthy during pregnancy by including the hashtag #HealthyBodyIsAMust and hashtag #ClinicIsAMust. Hashtag #HealthyBaby, HealthyYou to our NFPB Jamaica, PROMAC, MOH Jamaica pages. We want to stay in touch with you and see what's happening so we can support you and encourage you as you go on. I want to thank my panel, Dr. the Honorable Christoph Ton, Minister of Health and Wellness, Ambassador Malgorzata Wasilewski, Head of the European Union Delegation in Jamaica. Also with me, Dr. Simone Spence, PROMAC Coordinator and Director of Health Promotions and Protection in the Ministry of Health and Wellness, Lovett Byfield, Executive Director at the NFPB, Dr. Carol Lord, Program Development Officer, Family Health Unit, and Denise McFarlane, Public Health Specialist, Planning Institute of Jamaica, who both joined us via Zoom. We also want to acknowledge Mr. Gabriel Marinozzi, Corporation Section Delegation of the European Union to Jamaica, Dr. Melody Ennis, Dr. Dana Morris-Dixon, Diane Thomas, Mrs. Marie Gooden, Ms. Alicia Stewart, Professor Wendell Abel, Mrs. Lynette Vessel, and Nurse Marcia Thomas Yetman, Regional Nursing Supervisor, Southeast Regional Health Authority. I'm Delia Harris. Thank you so much for being a part of our media launch and for joining us. Please visit the clinic now. Healthy Body is a must. Clinic is a must. Have a good day.
Meet Keisha, a 35-year-old secretary. She just got some surprising but good news that she's itching to tell her partner. Meet Chris, a 40-year-old mechanic. He just heard the news. Keisha's pregnant.
Babes, I'm not sure about all this pregnancy thing, Plus, what about the sugar where doctors say you have trouble with?
Oh yeah, that sugar something there. I don't even remember about that. What we are going to know?
Now would be a great time to set your first doctor's appointment.
But once you talk about doctor, expense that.
Remember, free healthcare? You can visit any clinic close to you. We have many free health centers that offer antenatal services. Healthy baby, healthy you. It's easy to learn what to do. This message was produced with the financial support of the European Union in partnership with the government of Jamaica. Meet Keisha, a 35-year-old secretary. She just got some surprising but good news that she's itching to tell her partner. Meet Chris, a 40-year-old mechanic. He just heard the news. Keisha's pregnant.
Babes, I'm not sure about all this pregnancy thing, Plus, what about the sugar where doctors say you have trouble with?
Oh yeah, that sugar something there. I don't even remember about that. What we are going to know?